Today I have the pleasure to share this space with Lillian McCann, Senior VP of Operations and IT Services. And I'm Valerie Guillon, the Chief Operating Officer at CCD Health. We're a firm dedicated to outpatient scheduling services for radiology and healthcare centers with over 11 years of experience. We welcome you to this fireside chat, The Power of Patient-Centered Care, a strategy to reduce costs in radiology practice management.
It's a pleasure to be here, Valerie. Thanks.
Thank you. So today we're going to talk about some unique approaches that can make a big difference. You'll discover how focusing on patients and putting them at the center can lead to better results while also being cost effective. This is an exciting way to improve both patient experience and the bottom line of radiology practice management. In healthcare, we usually hear about doctors and nurses as the main characters, handling interactions in the front desk. But have you ever thought about the people who assist in making sure radiology departments work smoothly? Today, we're digging into the world of managing scheduling workflows, which isn't usually taught to doctors, nurses, or medical techs.
Val, sounds good. Why don't we dig right in?
Great. So, in large healthcare or radiology centers, when they hire someone to lead, like a center director, they usually ask for academics. But they often don't realize how important it is to have good leadership and management skills too. Sometimes the main leader lets someone else do the managing to save time. But this other person might be good at managing, just not at understanding all the medical stuff. This lack of attention to managing itself can cause bottlenecks, like patients not being fully satisfied with the service and even how the hospital works. Not too long ago, healthcare quality hardly extended beyond medical treatment. Even now, everyday matters like capacity planning, staff scheduling, and waiting times. Those were seen as not essential, despite their effect on patient satisfaction and hospital effectiveness. Times have changed rapidly, though, and in the late 1990s, the United States Joint Commission launched a national program to measure hospital quality to ensure high standards on providing safe, quality care. By 2002, hospitals were required to report data on aspects of care. These initial steps faced resistance, but progress continued, introducing new reporting requirements tied to patient satisfaction and outcomes for specific conditions. An array of performance measurement systems has since emerged to support these needs. So Lillian, can you share some insights on any of this?
Valerie, the healthcare sector's quest for improvement have drawn lessons from standardized management practices used originally in the business world. Some of the ones that we can mention are, for example, our Deming's Plan, Do, Act cycle. This one is highly recommended by the Joint Commission. We also have Six Sigma's focus on reducing variabilities and lean production's waste elimination techniques. All of these have been made their way into healthcare. We sometimes ask ourselves if these approaches work effectively in healthcare the same way they do in the business world. So that question obviously is still out there. Many papers mention the success of cost savings, shorter wait times, increased volume, and obviously heightened safety. It's really important to acknowledge that healthcare processes often evolve without deliberate thoughts towards effective efficiency, let's say. The key to improvement lies in recognizing problems and obviously taking action, taking hold and moving with it. So by better understanding some of these complexities and the proactiveness that we can engage in, we can always target continuous improvement within the sector. At the end of the day, let's think of it this way. The willingness to address an issue is the driver of success for that issue. Okay?
Yeah, that's true. And all those practices are pillars for gaining efficiency. How about we discuss some of the most important aspects to consider, for example, when looking to achieve a cost reduction strategy, that focus on patient-centered approach?
Sure. One of them we can talk about is data quality.
Yes.
Data quality usually comes very easily to mind. We can say that there's three main rules to data quality in the day-to-day. First of all, we need to make sure that it's original. When we're looking at this originality, what we're meaning is that, first of all, the data has to come from the source, specifically that we're going to analyze to look in regards to that data. The second aspect that we normally look into is that the data is sufficient. And when we're talking about what does sufficient mean is basically what needs to target the operation. Does it need to be a week? Does it need to be a month? Do we want to look at year-over-year data for that period of time that we're looking at? At the end of the day, the daily operations that we pick and the trends that are most important to us is what's going to decide the data quantity or timelines that we're going to look into, right?
What you can get out of it.
Yeah, exactly. Lastly, a structure of this data is key. And when we talk about structure, what we mean is we already know where it's coming from. We already know if it's a significant amount of time. How is it stored? And that's what we talk about in structure. Is it in a safe database where not a lot of folks are touching this data that could corrupt it? And basically that we ensure that it's not manipulated for inefficiencies. Hoping that makes sense for you.
Yeah, it did. It was very clear.
Awesome.
And now that you say this, an example that comes to mind, let's see, imagine all the data about patient arrivals, schedules, exam start times. Imagine that we're tracking all of that. With these data points, creating possible QA metrics like patient waiting time, average exam type per day. With those KPIs, a manager can grasp and actually be straightforward in their management practice.
Definitely.
So let's say that your data shows a patient waiting for 100 hours for an exam. Does that look right?
Never.
Would that even make sense? That's definitely a mistake. So what caused it? Why was it inaccurate? Was it a timestamp? Was it a scanner clock that wasn't calibrated? Some accidental action that led to that error? So taking a closer look at how you're collecting that data and ensuring that you can decode the story behind that data, that's what it's all about.
Valerie, in essence, at the end of the day, it's about the managers who can take that data and look at those daily insights and make it work. Do you have anything else in regards to scheduling to mention?
Yeah, I think it's a great opportunity to talk about scheduling and how scheduling plays a role in cost reduction efforts.
Oh, yeah.
So let's review a second vital aspect of reducing costs in healthcare and radiology centers. So scheduling, that task that we all know and we work on our day-to-day, it's a task that is aimed at making performance predictable, right? Yes. So while you do it based on intuition, it's smarter to apply a cost function to play that scheduling game strategically. You might want to schedule appointments in a way that optimizes the use of your valuable resources or minimizes expense. Self-scheduling, which we know,
popular.
It's a tools in a customer portal, for example, that it optimizes the phone system, right? So we try to make that all general inquiries call go to another area, and you dedicate that scheduling line just to the person who's going to help you finish that appointment. So the pursuit of that cost optimization has given rise to ingenious strategies. We've seen a lot of research papers and theses that have explored into scheduling, especially in healthcare. However, if all those strategies are fully implemented, hospitals would be efficient and timely havens.
Completely agree.
It creates a dilemma, right?
Yep.
We have advanced algorithms that have been designed to handle smart scheduling, yet healthcare often lags behind, using outdated tools and a one-size-fits-all approach.
Ouch.
So why is that?
The one-size approach. Well, it's likely due to not giving enough attention or priority to some of the timelines. It's also because the focus isn't clear on which aspects of performance we need to optimize.
Yeah.
And sadly, the reality we see in healthcare is that it tends to be the last in line to adopt any of the new technologies. There's no instant fix for scheduling inefficiencies. We don't have a magic trick or a magic wand where everything can run smoothly. However, being aware of these problems and looking for new ways of managing the challenge is a crucial first step to improvement.
That's right. And it's a very complex process, right? Today we're diving into a world of radiology scheduling, and it's more than just picking a time for an appointment. It usually involves matching patients with specific devices, radiologists, room, and resources.
Text.
Yes. So radiology scheduling comes with various challenges. For instance, the requesting doctor might handle it during the ordering process, while others might say go to the imaging center of your choice. Then when we talk about an emergency scan, the doctor might send you directly to a specific radiology center. And in this case, an algorithm and the order entry system guides the pre-selection of time, place, and equipment. On the flip side, a centralized scheduling center could change it all if called. So scheduling an X-ray for a walk-in service or even a same-day appointment might be straightforward, happening on the spot for the current time and place. Each approach has its drawbacks, and many places adopt a mix of all three methods together.
Right. Valerie, I think it's important to mention that here at CCD, we've embraced centralized scheduling. This shifts the responsibility from scheduling away from the outpatient center, away from the front desk, in order to free up more time for them. The approach, we've done it correctly by having well-trained individuals, minimizing scheduling errors. Typically, a contact center manages centralized scheduling, and thanks to modern communications technology, this can be done across multiple locations. Think of a distributed central scheduling line. However, maintaining quality of service can be really, really tricky, and radiology call centers demand for a skilled workforce. They want reliable phone access, proper staffing, convenient hours of operations to target the window that they have, and obviously either a very awesome QA system or a great QA team. Managing all of these can be challenging and even lead to some type of complaints every once in a while. But luckily, phone systems offer valuable data to gauge performance, to see where some of these opportunities lie so that we can target actions for them. For example, we can talk about abandoned call rates. These should ideally trend between 2 and 3%, which is a telemarketing TCPA benchmark. Average calls should be answered anywhere between 20 to 30 seconds to gauge and have a proper service level. And all effective scheduling basically is at the heart of the smooth transition behind those data indicators for taking care of the patients that are calling in quicker, right? I think it's a good point or a good segue right now to talk about variabilities. When we talk about variability in radiology scheduling, we know the expected duration and equipment needs for each of the imaging procedures is one of the first steps. Now, while different exam durations are often rounded in time and common for everyone, we may say an MRI can take anywhere between 45 to 60 minutes and say that this is universal. However, we need to remember some of the wise words of a theoretician. When we use a universal, it's just pure nonsense. Right? And this also applies to scheduling and much to anything else. In scheduling, what we call non-universal variables can throw a wrench into any operation.
And why is that?
It's obviously some of the different components that come into play. So, why don't you talk to us in regards to some of those?
Sure. So there are what we call these predictive deviations For example, like you mentioned, take an MRI and a CT, for instance. MRI usually takes longer due to slower imaging formation, while a plain radiograph can be much quicker. Nuclear studies, on the other hand, require time for injections and sometimes metabolic distribution. So that variability you mentioned also comes from evaluating different conditions. Like we say, condition X might require more images than condition Y, influencing the protocol. So this is predictable only if we know the protocol during scheduling, right? So there's a variation in pre and post procedure activities tied to imaging. Safety screenings for MRI and nursing evaluations for interventions contribute to this as well. And finally, there's the unpredictable twist, right? So we're dealing with people here. So late patient arrivals, unexpected events during procedures like reactions, claustrophobia, these can all shake up our plans.
Shake them up, they will, and sometimes we need to remember and be centered that the goal to scheduling is to lessen any of those variables whenever we can. And how do we tame something so changeable, so unpredictable? It's challenging, but understanding these sources and the different degrees of this predictability is key to crafting a proper scheduling team and scheduling group. In a nutshell, scheduling is very, very intricate and full of variabilities.
Definitely, yes. So we want to talk about cost saving, but what is that cost? What's the cost of saving money, right? So we often design schedules to minimize certain costs, but what do these costs actually entail? Creating availability comes with expenses, such as procuring new equipment or expanding our workforce. However, it's not always just about us. Sometimes the costs we're trying to minimize have wider implications. Think about an emergency department striving to swiftly conduct imaging after an order is placed. To achieve this, we might need additional resources during periods of low demand to effectively handle that high demand. So at the end of the day, like you said, it's all about optimizing resources while considering the broader context, right? And we see things from the imaging center's point of view first, right? But when we talk about it, I mentioned we're talking about people. So what about the patient's expectations, right? Imagine the world of medical appointments as a blend of airplane travel, hear me out, and a simple haircut. The parallels may not be immediately obvious, but they hold intriguing insights. When you book a haircut for 10 o'clock, we naturally arrange our day so that we are seated there at the barber's chair at that exact time. The idea of arriving 45 minutes earlier seems absurd. So air travel paints a completely different picture. We're repeatedly reminded that we need to gather an hour ahead for domestic flights and even 2 hours for international. We understand, we obey those rules, and we're there on time. So in healthcare, we adopt a similar practice for scheduled patients, except it's not as clear-cut. Unlike airline travel, where the reasons are very open and very understood, patients often arrive early for medical appointments without any fully understanding the necessity of their early arrival. This lack of clarity, both for patients and for us, challenges achieving high patient satisfaction. For a radiology department to succeed, this is vital, and every member should comprehend patient expectations.
Strikingly, Valerie, the healthcare world views on-time performance differently. Airline companies recognize on-time arrival as important as on-time departure. They often pad those schedules to make sure that there's compliance with those and accommodating possible delays.
Yes.
However, in healthcare, we focus on appointment arrival time, and we communicate when patients, we rarely communicate when the time frame that patients will take in the room, right? In the imaging center. Basically what we do is that we give them a bird's eye view on that. And some examples that we can talk about in regards to things that are extremely important in a proper scheduling process is patient no-show management, making sure that We know who's coming in, when they're coming in, why they're not coming in, would maximize some of those airline technologies that could be applied to an outpatient imaging center. Submitting appointment reminders obviously is extremely important. Screening questions, when we think about the type of exams that we need to schedule, screening questions are extremely important. You know, something as simple as a mammo. You know, it's either a screener or a diag. You're not going to know which one of the two you're going to perform unless it's a first-time incident or if there's symptoms. As soon as symptoms show up, it's a diag, and there's different processes that need to take place. In other words, consuming patient time. That, again, it's just a bird's eye view that we provide. Another important aspect of scheduling for any imaging group is knowing what their KPIs are. What are those metrics that are important to the center? Is it exams performed? Is it specific type of exams performed? Over what period of time? Which ones are more revenue generating than others? Are we clear on some of those items? Is it the amount of appointments scheduled per day? Is it the calls that come in per day that are important in some of those KPIs? Monitoring the calls, monitoring abandonment ratio, all of those are actually great examples on how to make the centers more efficient in regards to some of those. And obviously addressing the challenge is paramount for any of these imaging groups. In conclusion, the KPIs or the techniques that any of these groups to have cost effectiveness will be designed based on the group and the different type of exams that they're hosting at the site.
And their cost management strategy, right?
Exactly.
So as we begin to wrap up this today, Lil, we contemplate the relationship between healthcare and appointment adherence, right? And it's important to remember that much like a well-coordinated airplane journey, like I mentioned and you mentioned, a seamless medical appointment experience is grounded in clear communication, understanding patient needs, and maximizing efficiency.
Definitely. You know, and I just want to say thank you, Valerie, for having this chat with me today. And if anybody that's watching wants any additional information, you can go to our website at ccdcare.com. You can look into our Elevate services that are also in there. Check out our LinkedIn profiles.
Yes, you can reach out.
Yeah, just reach out and we'll be there to answer any questions you have. Thanks, team.